Yes, it is, and it is also a Tuesday morning, which means we're joined routinely by our Dr. Darren Green to discuss all things medical and health. And of course, the month of November is now Movember. And according to the Movember Foundation, testicular cancer is the most common cancer among young men between the ages of 15 and 39 years of age. And of course, we know that the testicles are a part of the male reproductive system that are responsible for producing certain amounts of hormones and sperm for reproduction. But of course, testicular cancer in particular is an abnormal growth or a tumor that develops in either one or both of those of the testicles, and it is a highly treatable cancer and often cured if diagnosed and treated early enough. And that's exactly why we have Dr. Darren Green here to discuss this with us. We want to know what it is, what causes it, how can it be diagnosed, what are those symptoms, and of course you can give us a call on 021 430 9881. The good doctor.
Good morning.
Good to see you.
It's always good to have you here. I mean, it's always just such an informative time with you sitting here. But the first thing I want to get out of the way and understand is what exactly is testicular cancer?
Yes, well, I mean, firstly, a lot of people don't know where the testes are, what they are. They don't know that there's a difference between the testes and the prostate. So if you look at this picture over here, you'll see a cord, and at the end of the cord, it looks like an acorn that's suspended from the cord.
Yes.
And that acorn is your nad, your nut, your testes, as we call it.
Is NAD a medical term?
Gonad.
A
It's
gonad.
an abbreviation
It's a
for your
medical term.
gonads, yes.
Is that what it is?
So your testes are obviously, small children will refer to them as your eiertjies, which lie in the scrotal sac.
Yes.
You know, otherwise known as the ball bag to young people. But anyway.
It's got many names.
Wow,
Many
that's
names.
amazing.
Many names.
So understanding exactly where they are, it's important, because in order to identify what a normal testy is, you need to firstly know where it is, you need to know what a normal testis feels like.
Yes.
Yeah.
Because we need to be able to detect and pick up abnormalities in that structure. And obviously you've mentioned its function already. It helps make sperm cells, and obviously along with that also involved with the production of male hormones, testosterone.
Yeah, exactly. And so to that effect then, what is testicular cancer? I know that I briefly described it as an abnormal growth or tumor.
As in most cancers. So you'll have then an uncontrolled growth rate of abnormal cell types.
Okay.
Originating from the tissue. And in the testes specifically, we speak about germ cell or non-germ cell in terms of the origin, in terms of what the initial cell type is. And obviously, the rate at which it grows, the prognosis, the treatment, the management thereof would depend on what type of tumor you have growing on top of the testes.
Yes.
Whether it's just in the capsule, whether it infiltrates the actual testes itself. And then we plan management around that. And there, obviously, a beautiful depiction of the symptoms associated with it. So, yeah, as you said, it's a cancer of young men, age 15, between 15 and 30.
39, which
you
is
know,
quite
so
insane,
it's often a very young crowd. And it presents, obviously, the difficult part.
And those symptoms, just those quick symptoms, Dr. Darren Green, what are they?
So a painless mass is one of the first things that you saw on the screen. And you can look at an enlargement or swelling. You often find that there's a swelling on top of the normal testes. Pain in the testicles is not always there, but you can have it. Because of the effect of hormones, you could have a breast growth under the effect of the hormonal development of
So it's not
the
just on the
disease.
testicles.
No. And then, of course, the other symptoms are related to when it's spread already. Lower back pain due to metastatic disease in the bone, when the cancer is already spread to the lymph system and the bone. Shortness of breath when it moves to the lung. Headaches and confusion, obviously, as well, when it becomes quite a systemic spread of the cancer. And then, one needs to then obviously understand referred pain to the abdomen already occurs, obviously, when it's developed quite significantly.
All right. Well, yeah, we're going to take a brief break from the conversation, but we'll continue again with Dr. Darren Green. Our lines are open 021 430 9881 as we continue to discuss testicular cancer. What I'm most interested in is what causes it. How do you go from one day without and then the next day it's like, it's happened. Why? And also I want to ask Dr. Darren Green the meaning of the word metastasize. We'll find that out after.
That's a word.
It's my feel-good breakfast show.
Welcome back. You are still tuned into your feel-good breakfast show, Expresso, right here on SABC3. And it's a Tuesday. That means that we are having a medical discussion with our favorite doctor, Dr. Darren Green, talking about testicular cancer awareness, what it is, what causes it, some of the things you need to look out for in order to sort of assess if you do or might have testicular cancer, right?
Indeed.
All right. So let's talk about the causes.
Yes.
Because it seems like you go from one day where you don't have testicular cancer to the next day you have it.
Sounds so rapid.
What happens in between? What causes it?
Yeah, so obviously the origin of those cells that form that grow at an abnormal rate and are abnormal in their structure or morphology. That is what a tumor is basically for any cancer.
Yeah.
You have uncontrolled cell growth of atypical cells. Now, what causes a cell to become atypical or abnormal? Stress on the cell. And stress on cells comes from an array of things in life. Genetically, certain genes can be triggered that trigger cancer and the development of certain types of cancer and abnormal cells. But also, stress on those things could include, obviously, things like lifestyle stress in terms of what you're going through on a day-to-day basis.
Like actual
Stress, because stress affects your immune system and your immune response and modulation to different aspects of your health and wellness. And when we speak about the cancer specifically as well, under the influence of things like trauma, obviously that's a stressful thing on a cell or an organ. Trauma, we can also speak about the effects of lifestyle. Things like smoking increase your risk. Things like being sedentary and having obesity also increase your risk of developing testicular cancer. And so does smoking, for example. So people aren't aware of those associations in terms of minimizing the risk. But I mean, I had a guest on a show last week, Western Province Sevens rugby player that came out to tell the world about testicular cancer. At the age of 27, he was diagnosed. The fittest, healthiest, cleanest eating person that's as fit as well. And such an inspiration. But he developed it. So it doesn't mean because you are healthy that you'll be immune to it. So cancer sometimes, unfortunately, can come through even in people that have healthy lifestyles and good lifestyles. The question is, if you know about the risk factors, what are you going to do about them? Are you willing to modify them to decrease your chance or not? And that's what it comes down to.
But my next question is exactly that, is how do I prevent it then? How do I prevent testicular cancer?
Yes, so preventing yourself dying too early and dying of testicular cancer means you taking ownership of your gonads and your nuts and examining them once a month. Once a month is all we need. It's funny how many times people don't know. They don't know, obviously, what a normal testis feels like. So you've got a lovely shower head there telling you to examine your gonads when you're in the shower. Because with heat and temperature, the scrotal sac obviously relaxes. And there in that form, you can then palpate and feel a lot easier. You can feel, obviously, if they're one or two testes. You can also feel the size of the testes by grabbing them between your fingers, obviously. Also, whether there's abnormal pain due to obstruction or due to an additional mass. So very important for guys to realize this. And often partners find out that you've got an abnormal testes in an intimate relationship. They can sometimes say, but something's not right here. So men need to be aware of the fact. Just like women have to examine the breast monthly, we need to examine the testes monthly.
Basically, we need to know our testicles.
Basically, you need to just take a screen grab of that graphic and keep it somewhere in your gallery. Or like, just as a quick reference every once in a month. Oh, it's that time of the month, need to check, shower, and do your thing. All right, 021-430-9881. We'll be right back. More testicular cancer talks with Dr. Darren Green.
It's my feel-good breakfast show.
Welcome back. It is your Feel Good Breakfast Show. We're engaging with you on this Medical Tuesday. Dr. Darren Green here to answer your questions regarding testicular cancer. We are in the month of November that brings a certain amount of focus on all things men's health, and testicular cancer is one of those issues. We had a caller who called in anonymously asking whether her husband is at a higher risk because their testicles, or the husband's testicles, were, when he was born, were inward. I'm not sure what medical condition that's called.
That's called an undescended testes, or you get what's called cryptorchidism. So normally undescended testes. So there's an operation that can be done to extend the length of the cord to actually allow it to be placed. And as far as I'm aware, there is no increased risk if you've got that for testicular cancer.
Okay, so he's not at a higher risk,
same risk as the normal population.
How would he examine it there?
No, you'd have to have a sonar done, obviously intermittently. And, a lot of people don't know that you can survive without a testes. Because a lot of people have trauma to the testes, or you walk through the turnstiles at a shopping center, and boom, you get knocked on the nuts, and then it comes up, twists, and twists the cord, and you have what's called torsion, where the blood supply to one of the testes is then actually cut off. And you can then have excruciating pain and lose it. It actually dies. But you can still live with one testes, and it can still function, and you can still produce sperm cells and still be fertile with one testicle.
Yeah.
Wow.
So earlier on, we saw the graphic that showed how you can do a self-examination. And of course, like you said, during intimate times, the partner can also contribute to that.
There we go.
How often should you be getting checked up? Is it once a month, like you said, right?
Yeah, so once a month you examine. If you discover anything abnormal, obviously, to have it checked out, you would go and see your practitioner, who would then refer you for a sonar.
Okay.
And a sonar is definitive enough to look for an additional mass. Because you do have fluctuating swelling. Above the testicle, there's an area, a cord, that's very convoluted, in other words, twisted. Like a kronkle.
Yes.
And that cord can swell up. It's called the epididymis and the vas deferens. There we go. There's a beautiful. You can see it, that epididymis, just above over there, right here. And what happens there, that can swell up due to things like inflammation, due to a blocked tube and so forth, and the buildup of sperm sometimes as well. And then you could have a bit of tenderness there. That doesn't mean you've got cancer, but that will go away within a week, for example. And the swelling will also fluctuate and go down again. We're speaking about growths, and a lovely picture here in yellow where you can see the actual position of a tumor starting. And initially it's small, you don't even feel it. But as it grows, obviously
Then you start to feel it. Let's talk about treatment.
Yes.
What treatment options are there?
So 95% of testicular cancers are fully treatable if detected early. 95%. So that's why it's so crucial that we find it before it obviously spreads and becomes seeds to the rest of the body, with the word you used.
Before it metastasizes.
Yes, beautiful.
Which means the spread of...
Spread to the other...
I mean, look, Kat's become a doctor on this show.
There you go. There you go. So yeah, important to understand that, and you need to obviously prevent that happening. So in terms of treatment, we use... Obviously, the tumor can be removed, or the whole testy can be removed, depending on the type of tumor and the size and where it's infiltrating. And then, obviously, along with that, there are things like chemo and radiotherapy, depending on the stage of the cancer you've got, whether it's spread to the regional lymph nodes or spread to lymph nodes in the abdomen, and radiation therapy as well.
Okay,
Dr.
right.
Green.
Well, Dr. Darren Green, still hanging out with him right here on your Feel Good Breakfast Show Expresso, discussing testicular cancer and really just shining that spotlight on it. Give us a call, 021-430-9881, if you have any questions for him. We'll be back with more after this.
It's my Feel Good Breakfast Show.
All right. We're back again with Dr. Darren Green discussing testicular cancer. It is the month of November, and we are focusing on all things men's health, and this is our particular focus for today. The question that sometimes comes up is, if I have testicular cancer, does it mean I'm infertile?
No, it doesn't necessarily mean that you're fertile. Remember, you've got two testes, and having tumors on both at the same time is very rare. Secondly, your testes can continue producing sperm cells even while you have cancer. Remember also that one can have your testes removed surgically, obviously, when you have infiltrating cancer and so forth. But there's always an option for people that still want to have children to freeze your sperm cells. Just as women freeze their eggs, you can also bank them. And that means that you will then still have a likely chance, if caught in time, obviously, of having your own children.
We have a call on the line. Bandile is on the line. Bandile, welcome.
Hi, how are you?
All good. What is your question for the good doctor?
Good. 3 years ago, when I was still in matric, I noticed that there's a lump-like thing on my right testicle. Then I went to the doctor. The doctor said it must be an epididymis swelling. And then because my testicle was the right size and there wasn't any pain, they said I should come back if I noticed any differences. But there hasn't been any differences for 3 years. So is it just a normal lump, or will it change over time?
Thank you very much for that question, Bandile.
Yeah, so he mentions the swelling, and he's apparently been 3 years since he actually detected it. Went to the doctor. Obviously, the doctor would have examined it, just found out, was it the cord itself, the cord, the epididymis and the vas deferens above the testy, or was it just the actual testy itself? Sounds like it wasn't on the testicle itself, according to what he's saying. But obviously, as I would say, if it's something that bothers you and stays there, and you don't, and you have progressive symptoms, you would do a sonar to go and definitively look, where is the lump? Is it attached to the testes or the shell around the testes or not, or is it separate in the cord? And that's a definitive way. So as long as he's re-examining himself, looking for changes in size of that growth, etc., and if there are no other associated symptoms that we've discussed, obviously, as well. But imaging is always definitive in looking at a mass.
So when you've tried to examine yourself, when you've tried to touch and feel for any changes or any uncomfortable spaces and things, a sonar is definitely the go-to place.
We've spoken about treatment, and that there is a chance that you could lose a testy or two,
Yeah.
depending on the level of cancer and whether it has metastasized or not. What are the risks associated with treatment or the possible side effects?
100%. So the first treatment obviously would be surgical removal of the tumor, and that often all surgeries carry risks with them. The risks of things like infection, risks surgically of things like damaging nerves when you have surgery. Obviously the skill set of the surgeon is always something that you want to go and look into, the history, the experience, etc. But it's a relatively simple procedure. But in terms of the treatments of chemo and radiation, like chemo and radiation for other cancers, the risk factors are multiple. Not risk factors, the side effects. So nausea is a big one. Pain can be a big one. Obviously with chemotherapy, ask anyone that's had the red devil or gone through chemo, where they lose their hair, where they go through all the gastric symptoms of loss of appetite, loss of weight, all those kind of things. So prepped for that and knowing what can come is also important in terms of you planning your diet, planning your support structure, your infrastructure at home, and so forth.
Wow, Dr. Green.
Thank you very
It's a
much for
lot.
that very enlightening conversation.
you, guys.
And also
Thank
thank you
you.
to everyone who called in and shared their stories and their questions. I think in lieu of the fact that this is a fact of men's health, we do encourage you, as the good doctor suggested earlier on, to self-examine once a month and to make sure. And if you have any doubts, go and see your medical practitioner to ensure that you are on the safe side.
Because
We're
you
gonna
will
take a
always
quick
know
break,
after the break, right?
Yeah.
We've got a winner home design duo joining us in studio. It's gonna be
and
fun.
the Zolani Youth Choir coming to you live on your Feel Good Breakfast Show.
Only you can make my day.